Hello and welcome to North Bay's Doc Talk live chat on COVID. We had a few technical difficulties. We're hoping this one's working now. Please post a comment if you can hear us. If you're having any problems hearing, let us know that too. With us today is Dr. Seth Kaufman, who's going to talk about the latest information on COVID-19 and the vaccines, etc. Sorry for the delays. This will be a half-hour chat. Take it away, Dr. Kaufman.
Thanks, Robin. So sorry about that. Apparently, for the first 10 minutes, I've been talking to just the phone. So I hope you're able to join us and you stuck with us. So as usual, for these sessions, I'm going to start with a few hot topics and then go right into your questions. Today's hot topics are you may be able to predict. So we're going to start by a discussion about Pfizer's approval to vaccinate those 12 to 15 years old, and then we're going to talk a little about Solano County's tier level, the fact that it remains in the red, and then we'll go right into your questions. So with that, let's start with a discussion about the Pfizer COVID vaccine for our 12 to 15 year olds. I think the first question is will I get my 13-year-old vaccinated? And the answer is 100% yes. And my wife and I are already looking for appointments for her, which is actually pretty easy right now to find. So the answer is 100% yes. And the question is, you might be asking why. So here's some things to consider if you have this age group and you're thinking about it. Number one is that the 12 to 15-year-olds can be a significant source of COVID. We know that from the upper Midwest, where there's been significant spikes, most thought to be at least related to the UK variant, which is now the predominant variant in California, or one of the predominant variants in California has overtaken the California strains. We know that at least some of the source for that spike was in youth sports. This is an age group that we want to be very active, who congregate a lot and is important for their development, important for them, and so they could be a real source for infection. That age group, there's good studies. The data shows that in that age group, they are similar to adults in how they transmit the disease. They can both get COVID and give COVID, pretty similar, we think, to adults. Once you get below that age group and you get younger and younger, we don't necessarily think they're a significant source of transmission. There have been outbreaks in elementary schools, but there's been much more outbreak concerns in youth sports of older age groups, middle schools, and high schools. So that's a really good reason to get your 12 to 15-year-old vaccinated. Another reason is that they can get severe disease. They're for sure lower risk. We know that as you get older, you're at higher risk for getting severe disease and getting hospitalized. But it's not that 12 to 15-year-olds, it's not that they have a zero chance of getting hospitalized. They have a chance of getting hospitalized and getting really sick. They also have a chance of getting that severe multi-system inflammatory disorder, MIS-C. And actually, for MIS-C, which is very rare, that age group makes up 20% of cases. 20% of cases. So I'm not trying to scare you. All of it is very low numbers. They're all higher than, in terms of getting severe illness from COVID, they're all higher than flu, by the way. But that age group also is low risk for getting flu. So they can get disease, they can transmit disease to others, including older people who are really at high risk. So secondary spread, maybe they don't get very sick, but they go visit the older person who decided not to get vaccinated and they get them sick. Those are all the good reasons to get your 12 to 15-year-old vaccinated. So then, is it safe to get that age group vaccinated? And the data is very reassuring that the answer is yes. When the press release came out last week that said, first there was news story leaks that it's going to be approved this week, and then finally the press release goes out, and my first thought was, before I schedule my kid for a vaccination, I kind of want to see the data myself, right? I'm not going to trust a press release saying it's good and safe and we should all do it and it's been approved. I want to see the data myself, and then now the data's come out. So it's ACIP weighed in. There's from FDA, CDC, and ACIP. There is good data, and the data is very reassuring. 100% protective for those for symptomatic confirmed COVID. Very, very, similar side effect profile maybe a little bit better in some areas, like kids maybe have a little less fatigue, maybe, a little more pain at the site, but pretty similar to older adults, that they'll have the same kind of side effects. More after the second shot, fatigue, headache, some might get a fever. None of that is dangerous. It goes away. No serious adverse events related to the vaccine. So it's all very reassuring. I don't have concerns vaccinating my kid. I want her protected, and so I will be getting my child vaccinated as soon as I possibly can. So that is my quick summary about vaccinations. Let's talk a little about Solano still in the red tier. So the first thing to know is that the numbers, while looking a little better, still put us in the red tier. I mean, that's why. There's a lot of factors that go into that tier level, but we still have cases we have new daily cases in our county that are in the low 30s. We are improving. Every day we're improving a little bit. That's a 7-day average, by the way, is that we're in the low 30s. We are continuing to improve. There's a chance before June 15th, when it's expected that all of California will reopen, and the people are talking about, beyond the blueprint. The blueprint, the tier risk levels for each county will go away. There's a chance that we could be in the orange by then, but unlikely. We're just not going to get there. And let's say we really meet that criteria a week before June 15th. Will we just stay in that tier and then it goes to normal after June 15th? I don't really know completely, but we continue to be right now we meet criteria for red tier. And there could be a lot of reasons for this. We have about 60% of our Solano community vaccinated with at least one shot, and about 40+% with 2 shots. That's actually pretty good that's not bad compared to the rest of California, but it's not amazing either. Is that part of it? What's the mask? What's our compliance with masking and distancing in our county? It's very mixed depending on where you are and what you're doing. So I think there's a lot of factors. So my reminder, especially for those that are just so frustrated, why are we still in this tier? Be really, we know that masking and distancing is really effective, right? And hand hygiene is really effective. We should continue doing it. Be really mindful that there's still cases. It's less in the news every day because cases continue to drop, right? And that's really reassuring. Hospitalized patients here at NorthBay, and I know for our other healthcare partners in our county, the amount of patients we have hospitalized is very low right now. In the entire county right now is only 16. That is a fraction of what it was, a few months ago. So all very reassuring. By the way, the reason why we have so few hospitalized, but we still have cases every day, is because the 60-plus-year-olds are, 70+% vaccinated. So we have vaccinated our high-risk patients. So now they're not, even if they get the disease, you can still get the disease if you're vaccinated. It's rare, but you can still get it. They are not getting very sick, and many are not getting it. They're not getting hospitalized. So we are protecting those with the vaccine. We are protecting those who are at risk for getting really severe disease. So with the vaccine, so that's really helpful. But we still have new cases every day. Remember that when you're going into stores, doing things, even as the county reopens June 15th, let's say, and we're normalizing everything, I think there'll be some good guidance from our county and our state that, hey, even though we're reopening really California, don't forget, still wear masks, be really mindful in areas where you're close to people and you don't know if they're vaccinated or not. It's going to be that kind of guidance, and I'd be very mindful of that because you don't want to get COVID. You just don't want to get COVID. And anyone who's had COVID on this call knows and felt it, knows that it just doesn't feel good. Whether you had mild symptoms or severe symptoms, it just doesn't feel good. It doesn't feel good. Okay, that is my opening for today. Robin, what kind of questions do we have?
Well, we have a question from Marion, who's asking if you could please explain the difference between health equity rate of 2% and the positivity rate of 7.1%.
I see. Yeah, that's a good question. So the question is about, tell me a little about the health equity rate of 2% and the positivity rate of 7%. my disclaimer is the health equity ratings are so complicated, they're actually a little hard for me to understand. I'm not an expert at it. The positivity rate is how many positive cases you have, and we continue to have, we're kind of sitting a little high. In other words, the number of tests positive, that's a messy statistic, right? Remember, if you test a lot of people, you could have a lower positivity rate, right? It's really the number of positive tests over the amount of tests you do. That's a positivity rate. We see a little high. I don't know how necessarily that relates completely to our health equity numbers, right? And the goal there is looking at the gap, like where are we in terms of testing and positivity rates in certain ethnic and racial groups. That's really the extent of my knowledge about it.
Okay. You talked about mask wearing, and I know some people, you say, I've got the vaccine, why do I have to keep wearing a mask?
Yeah.
Can you address that issue a little bit?
Sure. That's a good question. So the question is I'm vaccinated. Do I need to continue to wear? Why do I need to continue to wear a mask? There's two reasons for that, and of course the CDC has put out some guidance around this about people being in single households if everybody's vaccinated and they're low risk. That we are loosening that. Essentially, there's new guidance coming out as we get more and more comfortable with the protection from the vaccine. CDC and others are putting out guidance that allows you to really take off the mask with those that are vaccinated and low risk, right? But to answer the question directly, why do I still recommend wearing a mask when you're vaccinated? For a number of reasons. The mask wearing is most important when you don't know the vaccine status of others, right? So you're going into the market, right, and to get food, and it's not like people who are vaccinated have some sort of sticker on their shirts, or are wearing their vaccine card on their jacket. So the answer is we don't know what others' vaccination status is. You might say then, but I'm vaccinated, I'm totally protected. It is possible. We have seen breakthrough infections. It's possible. We don't see severe disease from that, but you can still get it even though you've been vaccinated. Nothing's 100%. Nothing in medicine is 100%. We give treatments and we start things, and all of it is a probability of it being protective. This vaccine has, it's a home run in terms of how it's protected our community, but it's still not 100%. It's just very, 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 very protective. We are also, I would say right now, that we're very closely watching the changes in the variants in California. Because there is concern, especially when we look at some of the Brazil variant and some of the others, there is concern the vaccine's not as effective against those. So, the California is sequencing, we're up to maybe 50,000 samples, and they are, the Brazil variant is kind of growing a little bit. The California strain, which we did feel pretty comfortable that the vaccine was working for it, against it very well, has dropped in percentage, and the UK variant that has caused kind of havoc in other states and other countries is rising. So that's another reason, like, we're just not out of the woods yet on this. There's too many variables to take off that mask, except when you're with people who are low risk, confirmed complete COVID positive, vaccine positive. They had the vaccine, and you're kind of, you're having small group interactions. That's the safest situation. You should be wearing a mask everywhere else and keeping your distance.
All right, this person's wondering if you have any statistics on those who had one shot and still get COVID, because their mom, who's 80 plus years old, could only get one shot due to a severe reaction to it. And so she's very cautious due to her fear that she may become one of those statistics.
Oh my God, that's a great question. So the question is how protective is the first vaccination for 2 vaccine shots? There is some data around that, although it depends on what you read. So, some see like 70-80% protective, depending on which vaccine you get. And then the question is whether it's very, very protective, but you just need more time. I would say that your family member, I think it's really important that you get both vaccinations, especially for an 80-year-old. If you were a younger person and you had a severe reaction, it's a little of a different risk-benefit discussion. The answer is it's partially protective, It's not 90+%. It's somewhere below that. And an 80+-year-old getting COVID is really dangerous. And I don't think anyone knows. We know that 2 shots are pretty much close or at 100% protective from getting severe disease. I don't know if there's any data on 1 shot. We've seen many people get COVID from after 1 shot. Still the numbers are low, but we've seen many people get COVID after 1 shot. So my advice to you, my strong advice to you, is to talk with her. She should talk to her primary care doctor about that, what that reaction was, and whether it really is a contraindication to getting the 2nd shot. If it was anaphylaxis, it is a contraindication. If it was a fever of 102, 103, and she did okay, which she probably did, it's probably not a contraindication getting the 2nd shot. It actually probably means she had a really good response to the vaccine. So just talk with your doctor. Obviously, I can't give that kind of advice over the airwaves here. But if your primary care doctor says you absolutely should not get it, she'll be partially protected and probably over time even more. But it's important to know we'll probably have a booster in the next year that will be important. And is she not going to get that at 81 years old or 82 years old? It's all about her age that makes me concerned. Talk to. She should have a good conversation with her doctor. Is it maybe she can take some medicine, which is not recommended by the way, but it's better than nothing, than not getting the shot. Could she, right after getting the shot, could she take some medicine? Talk to your doctor about it, and see if there's an option for her to get the 2nd shot.
It's good that you mentioned boosters because Kathy is curious to know how soon a booster might be needed.
Kathy, we are like perfect transitions here, Kathy. So the question is when will we need a booster? All the companies are working on boosters right now, and they're looking at the variants. I'll start by just saying that remember that viruses mutate like it's normal, and actually this virus mutates a lot less than flu. So it's not like, oh my God, this is a killer virus. It is a killer virus because it mutates so quickly. But we just never watched, in our lifetimes, we haven't watched a virus and had the technology to watch a virus so closely. So just letting you know, our virologists that follow this, they essentially say like, hey guys, this is called normal virus like life cycle. That viruses mutate a lot and then a few kind of make it through and have survival benefit, and that's what we're seeing. So this thing's going to keep mutating, and we will have to have boosters at some point. I don't know when. I'm guessing in a year there'll be some recommendations as the virus continues to change and become so different from the wild type, the original, and there's better studies looking at how protective the vaccine is, that the recommendation will be to get a booster. A year, I don't know, and that's a real guess. That's a real guess. But keep in mind that if we reached herd immunity and we really got everybody vaccinated, then this virus can't mutate. It needs a host. It needs a host. So I was just looking at some data, looking at prevalence, and it just shows that each level of vaccination rates, do you have 50% of your population vaccinated, 75%, which is heading towards herd immunity, 90%, and how much mutation can happen from the virus, and it's almost nothing when you reach that high percentage rate. So if everybody gets vaccinated, then this thing won't mutate so much, and maybe we'll even avoid having to need boosters over and over again. I think most of our experts say this is going to be endemic. This virus is not going to go away. It's going to be on my mind when I see patients in the ER every week for the rest of my career. It doesn't mean it's going to be the front line of the headlines of the newspaper. It doesn't mean we're going to be living with talking about the data every week, but we're going to be living with it maybe the way we live with it with flu and other viruses. We're going to be living with it, but we can live with it at a very low level if we just get vaccinated.
So Rosemary would like to know, are the COVID cases in Solano County still increasing?
No, COVID cases, Rosemary is asking a good question around where are we with rates, and no, they continue to drop. And this is available to you. It's SolanoCounty.com has, and then you click on the dashboard. You could see the 7-day averages, and it's slowly going down. It's slowly going down. Hospitalization rates, which is my #1 metric to look at, because it actually is with the positivity rates and the case rates, it does depend on testing levels, right? So but but the hospitalization rates that do not. If you get sick from COVID, you're going to the hospital, right? And so those have been kind of stable at very low numbers. Very low numbers. Overall cases have been dropping, but is that because people are just not getting tested anymore, or are they, or are we really seeing a drop in new cases? And I'm sure it's a combination of both.
Okay. Could you talk about the guidelines for fully vaccinated family getting visited by a family member who is not vaccinated? Together.
So the question is, what are the current guidelines? I think California Department of Public Health is working on putting out more guidelines around this. So my advice right now is if vaccinated individuals are seeing unvaccinated individuals, I think you should continue with our current practices for now until we get more data around the variants. That's my advice. I say that because and maybe my opinion's a little conservative or strict, because I see breakthrough infections, and I still have concerns that we could have a spike. And I would love to have a nice normal summer like you would. So my overall recommendation is that, especially with high risk individuals, which I hope they're vaccinated, I would continue to do mask wearing and distancing between those that are vaccinated and those that are unvaccinated, so that we don't keep spreading the disease.
You just talked about a potential spike. We just celebrated Mother's Day. Is there any concern that there might be a spike coming again?
Wait, Mother's Day was recently? I never called my mother. Yes, I called my mother. The question is with Mother's Day, do I expect to see a spike? It would be several weeks later at 50-60% vaccination rates, at least one shot in our county, which was close, a little above the California average. Do I expect to see a little spike? I expect to see a little spike, but hopefully not much. It's really hard to know at this stage because we keep adding variables, right? So it used to not be, we never put the vaccine status as a variable. It was always about what are people's behavior going to be, right? And that's what was very predictive around New Year's and Christmas. Like, people were so desperate for interaction, it totally makes sense. And we saw the expected spike. Everyone predicted it several weeks later. Will we see that post Mother's Day? Adding in the vaccine and really our county, our community, and others so used to mask wearing and distancing, and then you add in that we still continue to be in the red tier. I don't know. I think a little spike, but hopefully not too much.
Okay. There's been a lot in the news about this horrible case load going on in India. Is that another new variant, and do we need to be worried about that? Yeah, so
I don't know what's new anymore. Like, these have been out for a while, but the India variants are very concerning. And remember, the world is really small. Honestly, until we worldwide have high vaccination rates, another reason why this will continue to be an endemic virus. It'll just keep going around and around because it makes me happy that the world is small. We can go anywhere we want, but that's what happens. In terms of, you can't really create a lot of borders for the spread of the transmission of disease like this. But yeah, the India variant is a big concern. But it's not the variant's not, it's the variants in India are just one factor. They did have a very low vaccination rate. I don't want to misspeak. I don't remember the exact number, but it was very low. They have low vaccination rates. This is not my quote, but there are some thoughts around behavior and culture and the concerns around where their mask wearing compliance is high. So there's a lot of factors, and I would say vaccine is probably more important than the variant of why India is seeing such a horrible outbreak. And the key is to get, and I know that's what's happening now, the U.S. is sending vaccine, others are. The key is to get as many people vaccinated as possible, and for everybody else to be extra careful with their mask wearing and distancing. And in a place like Solano, where our rates are low, California lowest, some of the lowest rates in the country, I think we need to continue with our measures right now, because we know in other states and countries they're seeing spikes, and the world is small. The world is small. So that's another reason why I'm extra conservative right now in my approach towards whether we can just normalize and reopen the state. I think we can safely reopen things, but we all have to continue to be really compliant with our transmission precaution measures.
Okay, so I have to push a button to read this whole question here. Okay, when a person is vaccinated and around vaccinated and unvaccinated adults, how safe are they to be around children? I think that's what she's asking. Are the children safe?
Okay.
If the adults are vaccinated,
right.
are the children
I see. If the adults are vaccinated, are the children safe? I think is the question. That's a good question. It depends on the age of the children. If you have a vaccinated family, then you know, depending on the younger kids are probably pretty safe. We don't see a lot of transmission amongst young kids, 2, 3, 5-year-olds, 7-year-olds. So if you're talking, you know, if the rest of the household is vaccinated, and everybody's again doing kind of normal precautions, you're wearing a mask in the market. You know, you're avoiding, you know, being in congregant areas where you're too close to people and you don't know their vaccination status, and now you're not passing it around. Yes, the young children are probably okay. The chance that you as a vaccinated individual, so here's how to think about it. The chance that you as a vaccinated individual, fully vaccinated, get COVID and then spread it to your 4-year-old is low. That's very, very low. I can't say 0, but it's very, very low. Which is why we'll talk about it when the time comes. When the EUA comes out that says now you can vaccinate 2 to 10-year-olds or 5 to 7-year-olds, or I don't know what it's going to look like. It's kind of a bigger discussion about the risk benefit. The risk is going to be tiny, but do they need to be vaccinated? Are they a significant source of transmission? We know young kids are not. But still, again, I have a 13-year-old and I have an 11-year-old who will be 12 in January. So I don't know, I don't really, but if my kids were younger, again, both my kids are kind of adult level transmission risk, and I would feel differently about that age group. So, and if you heard the beginning of my talk, you know how I feel about it. For the younger age groups, again, I would just have them wear masks where they should, and I would be less concerned with, outdoor play dates and things like that, if that helps.
Okay. So if somebody wants to get the vaccine now in Solano County, what do they got to do?
Wow, the supply and demand. If you want to get the vaccine right now, you can get it anywhere you want. Anywhere. Like, there's so much vaccine right now and appointments open. Things have completely flipped with the supply and demand in the last month. Go to myturn.ca.gov. That's your best source. You'll see, you can sign up and then it's going to show you a list of where there's appointments open, and you'll see it's like everywhere. It's like everywhere right now. So very easy. So anyone who comes to me and says, I can't get an appointment, I want to get vaccinated. Yeah, it ain't true. There's a million ways to do it. Go get it. If you're hesitant right now, you still have a lot of concerns, talk to your doctor, go online, talk to your friends that you trust. It's a very safe vaccine. Go get vaccinated.
All right. Well, we've let this go a little long because we started a little late, so it's time to wrap up. But I do want to remind viewers to join us for our next Doc Talk Live. It's on May 19th at 4 p.m. right here on Facebook, when our urologist, Dr. Hurt Kara, will be talking about the topic, gotta go, can't go, hurts to go, and he's a urologist and he'll talk about and answer your questions. That is a great title. That is a great title of a urology discussion. We are going to take a hiatus from this Doc Talk Live. If there's a lot of updates, important things come out, we can always schedule one, but we're going to take a little hiatus, for a few months, and we'll keep you posted. We'll post something if we're going to have a session. And be safe out there. Thank you so much. Thank you, Dr. Kaufman.